In this video, I am going to discuss the nursing care plan and how to create one. So the nursing care plan, also known as the NCP, is a step-by-step approach to correctly complete the parts needed for a care plan. In so doing, we use the nursing process, the ADPI or ADOPI in some other nursing school format. So ADPI, the meaning is assessment, diagnosis, planning, implementation, and evaluation. For ADOPI, nalagdag yung letter O, and letter O stands for outcome. Okay, the outcome that we desire to our patient. So that is the ADOPI, and then the other format is the ADPI format. Care plans can be informal or formal. So an informal nursing care plan is a strategy of action that exists in the nurse's mind. Okay? So kapag naisip lang ni nurse, then that is an informal NCP. But the commonly used, especially in the hospital setting, the commonly used NCP is a formal nursing care plan. Kailangan siya documented, kailangan siya written, or in other hospital, computerized. Okay, so formal nursing care plan is a written or computerized guide that organizes the client's care information. So in our context, sinusulat natin yung ating NCP or the formal nursing care plan. So, pero yun na nga, in other hospital na they're advanced, they have this nursing informatics. So, gumagamit na lang sila ng kanilang iPad or ng gadgets to encode their NCP. Now, this is an example of a nursing care plan. So this is the ADPI format. Okay, so you have your assessment, you have your nursing diagnosis, planning, interventions, and evaluation. So um, tabulate siya, and then you have a column for each area. So this is the ADPI format. And then baka lang may makita kayong some variations in terms of the format. So eto siya. So sometimes naiiba yung labels on top. So si assessment, pwedeng ang mailagay dyan is defining characteristics, pero the same lang siya. It pertains about your assessment. Nursing diagnosis, just the same. And then ito si ADOPI. O stands for the outcome identification. Okay, yung outcome na gusto mong mangyari. And then, sometimes, ino-omit na nila si planning. Pinapalitan ng outcome na lang. Okay? And then, you have the nursing interventions. It could either be independent or dependent. The rationale or the rationale for the nursing interventions. And you have the evaluation. So, sometimes, ito yung format na makikita ninyo. Depending on your nursing school. In our case, I will show to you what is the format, or I will give you the format na gagamitin natin in our institution. The following are the goals and objectives of writing a nursing care plan. So number one, to promote evidence-based nursing care. So definitely, nursing is an evidence-based profession. We are after the evidences that we have. Okay, so we are highly scientific. Although definitely, nursing is also an art, pero we do not neglect the scientific aspect of nursing. So we are giving care to our patient based on the available evidences that we have. Number two, we support the purpose of, I mean, the goal, and another goal or objective of writing an NCP is to support holistic care, okay, which involves the whole person, which is our client, including their physical, psychological, social, and spiritual. Number three, to establish programs such as care pathways or care bundles. So when we say care pathways, it involves a team effort in order to come to a consensus with regards to standards of care and expected outcomes, while yung care bundles are related to best practices with regards to care given for a specific disease. So yung care pathways is like the consensus of the group, okay, with regards to the care na gusto nating ibigay to our patient. So it's a collaborative effort and decision of the healthcare team. While yung care bundles naman, these are like the best practices that we have with regards to the care to our patient or to our client, okay, with regards to the specific disease. And then number four, to identify and distinguish goals and expected outcomes. Number five, review communication and documentation of the care plan. So dito in your NCP, nakita nyo naman yung different parts, right? It includes the goals and yung gusto natin mangyari after the providing the nursing interventions to our patient. Ano yung outcomes na gusto nating makita sa kanya. So it also serves as a documentation na we provided care to our patients. And then measure nursing care. So through the NCP, we can measure yung ating interventions na ginawa to our client and the specific um, outcome or the specific result na nangyari kay patient through the nursing care that we have provided. Now, what are the different purposes of a nursing care plan? It defines, letter A, it defines nurses' role. So we all know that the role of a nurse is unique from that of other healthcare professionals. So therefore, having an NCP, it highly defines ano yung mga pwedeng gawin, ano yung mga dapat gawin ng isang nurse. Okay? And we are not just relying to a physician's orders or physician's interventions. We have our own nursing diagnosis, we have our own nursing interventions. So it defines our roles or functions. Letter B provides direction for individualized care of the client. So in crafting an NCP, you think critically as a nurse to develop a nursing interventions to our client, and that is highly specific. Okay, we do not have a one size fits all na care or interventions to our clients. So we craft an interventions based on the the client's signs and symptoms. Okay, based on the condition of our patient. So it's highly individualized. Letter C, continuity of care. So the purpose of NCP is to provide continuity of care to our patients. So definitely, di naman tayo 24 hours na nag-duty or nagbabantay sa pasyente, right? Or nagte-take care of our patients. So nagkakaroon tayo ng shifting among other nurses. Kaya naman, it is important na we have an NCP so that it can be the basis of other nurses pagka nagkaroon na tayo ng shifting. Okay? Pagka nagpalit na tayo ng shift, alam nila yung ginawa natin or the care na binigay natin during our shift. So nurses from different shifts or different floors can use the data na meron tayo through the NCP. Letter D, documentation. So definitely NCP serves as a it serves as a document. Okay, so if nursing care is not documented correctly in the care plan, then there is no evidence that care was provided. So, ang sabi nga, di ba, what is not documented is not done. So, we have to take note of this. So, kung ano yung hindi mo siya na-document, ibig sabihin, hindi mo siya nagawa. Okay, next, NCP serves as a guide for assigning specific staff to a specific client. And then it serves as a guide for reimbursement, if ever, for insured si patient. It may serve as their basis in terms of to determine what they will pay in relation to the hospital care that received by the patient. Letter G defines client's goals. And Yon. So those are the purposes of a nursing care plan. Now we proceed with the different components of NCP. So again, a nursing care plan usually includes nursing diagnosis, client problems, expected outcomes, and nursing interventions and rationales. So first, we have so these are the components, and we are now discussing the different components or yung aspects of an NCP. Pero this is just an overview. Mamaya, iisa-isahin natin sila comprehensively. So, number one, client health assessment, medical results, and diagnostic reports. So for this is the first measure to design a care plan, yung ating assessment, which also includes the medical results and diagnostic reports. So it is related to the following areas and abilities, such as physical, emotional, sexual, psychosocial, cultural, spiritual, transpersonal, cognitive, functional, age-related, economic, and environmental, meaning holistic. Okay, all aspects of our client, yun yung tinitingnan natin, all areas in terms of our assessment. The information in this area can be subjective or objective data. So mamaya I will discuss thoroughly about this one. So number two, we have the other component is the expected client outcomes, and this may be long term and short term. Okay, so client outcomes is the second. Sometimes, again, it is labeled as the planning aspect of the NCP. Number three, nursing interventions. These are nursing actions performed to address the nursing diagnosis and documented in the care plan. So ito yung ginawa, yung actions na ginawa natin para ma-solve yung ating nursing problems or nursing diagnosis. And then number four, you have the rationale for the interventions in order to be evidence-based. So nagbibigay tayo ng rationale or rational doon sa interventions na binigay natin para tayo ay evidence-based yung ating approach. And then number five is the evaluation. This documents the outcome of nursing intervention. So this is the respond or the response of the patient to the care that we have provided. Now, let's discuss the NCP components one by one. So, thoroughly di-discuss natin ngayon yung mga sinabi kong components na yon. And then, I will give you more examples for you to be able to understand this topic better. Okay, so let's begin with the assessment. So again, for the assessment, sometimes it is labeled as defining characteristics, collecting data or data collecting, or pwede rin siyang cues. So it depends on your nursing school kung ano yung format na ginagamit nila. Pero more common, so it is labeled as assessment. So nursing assessment, it is a process of gathering information about a patient's physiological, psychological, sociological, and spiritual status by a registered nurse. So ito yung assessment na ginawa natin sa ating patient holistically. Um, it is important definitely in shaping your NCP because this is the first step actually in creating or crafting our NCP. Now we have two types of data for our assessment, and you already discussed this for in our subject na health assessment, right? So you have subjective data and objective data. When we say subjective data, the patient, it is all about the patient, the information that the patient tells us as a nurse. Ito yung mga impormasyon na sinasabi sa atin ng ating pasyente. Like during the interview, ito yung mga information na nakukuha natin sa kanila. It may include feelings, pain, emotions, among others. Okay, pwede rin dyan yung mga perceptions, ideas nila. So, we get the subjective data through patient verbalization or ito yung mga sinasabi ni patient. Patient stated or patient verbalized that. Okay, so I'll show you mamaya. So that is the subjective data. The other data is about objective data. So subjective, it comes from the client personally. Sinabi nila sa'yo. While yung objective data, this is your own assessment or your own observation as a nurse. Okay, so it include vital vital signs, medical history, patient medication, lab test, diagnostic test. Okay, so ito yung mga na-measure naman natin. At yung mga na-inspect natin upon performing our objective assessment. Okay, so now so in this sample of the NCP, we have here, so nakatabulate nga siya, right? It's divided into different columns, and then you have here first the assessment. So you have here the subjective cues and the objective cues under the assessment. So pwedeng subjective lang yan, tapos ito objective. Okay? So for the subjective, quote-unquote siya. Nilalagay natin, for example, sinabi mismo, the patient verbalized na mainit ang pakiramdam ko at masakit ang ulo ko. Pwede mong idagdag dyan as verbalized. Do not forget, pakidagdag dito as verbalized by the patient. Kailangan naka-indicate dito kung sino yung nagsabi. Okay, so in this case, again, pakidagdag dito as verbalized by the client. Ibig sabihin that that subjective data came from our client or from the patient. Okay, so subjective cues or subjective data natin, mainit ang pakiramdam ko at masakit ang ulo ko as verbalized by the client. So that is our subjective cue. Now, for the objective cues, so ito nga yung mga na-measure natin, okay, objectively. So ano-ano, ito rin yung mga na-inspect natin. So examples are skin warm to touch. So for example, nung hinawakan mo yung skin niya, ni patient is mainit nga siya, flush yung kanyang skin, so parang siya ay reddish, okay, flush yung kanyang skin, tapos mainit, and then when you take the vital signs of the patient, so you got this record. So you have a temperature of 38.8 degrees Celsius, the respiratory rate is 30 cycles per minute, pulse rate is 100 beats per minute, and then tinignan mo yung result ng kanyang lab, and then nakita mo the WBC result is 18 um, times 10 slash per liter. Okay? So, ibig sabihin, mataas yung kanyang WBC count. Okay? So, probably baka ma-infection si pasyente natin. Okay? So, this is how you craft your assessment. Okay? You have the subjective cue or the subjective cues and the objective cues. Subjective data and objective data. And then, after the assessment, so by the way, in your the book or your NCP or Nurse Packet Guide book, for example, makikita natin ito, yung under the defining characteristics, makikita natin yung subjective and the objective parts. So, you can also have this as your basis or as your reference. Okay, although the patient have his or her own we have the subjective and objective cues coming from our patient. We can also refer sa defining characteristics sa NANDA book na meron tayo. Okay? This will just serve as an additional idea or information sa atin. Pero again, the care, yung nilalagay natin sa ating NCP, it should be highly individualized. Okay? Kailangan kung ano lang yung meron si pasyente, kung ano yung nakikita natin sa kanya, yun yung nilalagay natin sa NCP. Pero in the NANDA, I am just showing to you na we can also have that information or that data here. Okay? So, I hope clear tayo doon. Again, the care given to our patient at yun nilalagay natin sa ating NANDA, sa ating NCP, it should be highly individualized to our patient. Okay? Based on the subjective and the objective data that we gathered from him or from her. Okay, next. So this is now the nurse's packet guide or yung NANDA kung tawagin natin. And this is where we can have our information in completing our NCP. This is a very a big help to us nurses because almost lahat ng pwede nating ilagay in our NCP, dito natin siya makukuha. So, Nurses Pocket Guide, 11th edition. So, andito yung mga pwede nating nursing diagnosis. And then, for example, nagpapakita rin siya rito ng specific disease and then under that specific disease, ano yung mga pwede nating nursing diagnosis na magamit. Okay, for example, sa bronchitis, si pasyente ay may bronchitis, ano yung pwedeng nursing diagnosis na pwede nating magamit sa kanya depending again on his condition. So, ayun, it is a very good reference for us nurses. So, yun, let's now proceed to the nursing diagnosis. So for the nursing diagnosis, so we are done with the first component, which is assessment. The second component is nursing diagnosis. So it is a statement of nursing judgment and refers to a condition that nurses, by virtue of their education, experience, and expertise, are licensed to treat. So nasabi natin, di ba, that NCP defines our role as a nurse. So kung sila doctor, they have their own medical diagnosis, tayo naman, we have our own nursing diagnosis at by through our education, experience, and expertise, ito yung ating tinitreat sa ating pasyente. Yung diagnosis, nursing diagnosis na ating na-identify with our clients. Okay? So, as nurses, we first write the nursing problem, then medical diagnosis may follow. So, again, as nurses, sa pagsusulat ng ating nursing diagnosis, we first write the nursing problem. Okay, yung problem muna na na-identify natin. And then, the medical diagnosis na nanggaling kay the doctor, you may add that information. Okay? But again, medical diagnosis is not our priority. So, nursing diagnosis, it has to be specific. And it will depend on what problem our patient has. So again, individualized care yung binibigay natin to our patient. Now, we follow the formula here. So this is the three-part nursing diagnosis statement. Okay, so you have here the nursing diagnosis, the problem, and then the related to, or the etiology, and then yung as evidenced by, yung signs and symptoms. Kung ito yung PES kung tawagin na format. It consists of three parts. Yung problem, yung etiology, and yung signs and symptoms. Okay, to make it simpler na lang. So the formula is the nursing diagnosis related to blank as evidenced by blank. So ito yung format. So yung nursing diagnosis, you will refer to your NANDA and to your patient. And then, as is itong statement na to na related to. So, dito nilalagay natin yung mga nakuha natin, or I mean the diagnosis sa ating pasyente. So, mamaya I will show you ano. And then, as evidenced by, ito yung mga nakita natin na signs and symptoms. So, let's see. Okay, let's be specific. Isa-isahin natin. So, first, you have, let's first discuss the nursing diagnosis. So, ito again yung formula, no? So, let's see first the nursing diagnosis. So, nursing diagnosis, again, we get this from the NANDA, Nurses Packet Guide, or NCP book, or any reference that we have. Okay? By the way, NANDA is the North American Nursing Diagnosis Association. So sila yung organization na nag-internationalize ng mga nursing diagnosis natin. Okay, so again, we get this nursing diagnosis of ours sa pagka-craft ng NCP sa NANDA book or Nurses Pocket Guide or NCP. So you have to refer on that book. Okay, yung reference na meron ka. Now, in this case, in this example, eto siya. Makikita mo siya sa pinakataas. And in this case, we have here the hyperthermia. So this is a nursing diagnosis. Okay, so again, nursing diagnosis is different from a medical diagnosis. So that is the nursing diagnosis. So after that, we have the related to blank. So ano yung related to blank natin? Or R/T related to. So these are the related factors. The reason why we have the nursing diagnosis. So ano ba yung reason kung bakit tayong mayroong nursing diagnosis? Yun yung ating related to. Okay, these are the related factors. In crafting a related to factors, we prioritize the simplified pathophysiology of the disease process. So, ini-state lang natin yung simplified pathophysiology nung disease na meron yung pasyente. Okay, so, and then afterwards, we can now put secondary to medical diagnosis. Okay, so, I'll show you an example later. Pero for now, yun muna kung paano natin gawin itong related to. Again, these are related to are related factors. The reason why we have nursing diagnosis. And then, ito yung priority natin. And then we write this by simplifying the pathophysiology process. I mean the pathophysiology of the disease process. And then afterwards, we can now put the secondary to medical diagnosis. So I'll show you an example again later. And then punta muna tayo sa as evidence by. So paano naman itong as evidence by? So in here, we specify by placing here the defining characteristics from the data that we collected. Again, for as evidence by AEB, pwede natin siyang abbreviate. Okay? So we specify here by placing the defining characteristics from the data that we collected. So ito yung mga subjective and objective cues na meron tayo. Okay, as evidence by, sorry, ito yung commonly objective cues yung nilalagay natin dito. Although pwede rin siyang subjective, pero most common, objective cues talaga yung nilalagay natin dito sa as evidence by. Ito yung mga signs and symptoms. Okay, na meron tayo. Kasi madalas we place here yung mga objective data that we collect from our patient. Pero again, pwede rin naman si subjective, yung mga symptoms ni pasyente. Okay, so we now have here an example. So let's start. So the example, our data here, the patient's diagnosis is COPD exacerbation. COPD is chronic obstructive pulmonary disease. Okay? So ito yung diagnosis sa ating pasyente, nag-exacerbate yung kanyang COPD, signs and symptoms na nakuha natin sa kanya, wheezing on bilateral upper lobes during expiration, oxygen saturation of 90%, and then patient respiration of 26 breaths per minute. Although we also use this breaths per minute, pwede rin siyang cycles per minute. Okay, when we are referring to the respiratory rate or the respiration of the patient. So 26 yung kanyang RR. So paano tayo magka-craft ngayon ng ating nursing diagnosis? So in this case, again, para makakuha tayo ng nursing diagnosis, you refer to your NANDA book. Okay, pag hawak nyo na yung NANDA ninyo, you have your NANDA with you, and then you can now select or you can now identify different diagnoses relating to COPD. So your NANDA book will give you, for example, here, your NANDA book will give you different diagnosis for COPD, or in this case, we have chronic obstructive lung disease. So, hanapin niyo lang siya, nasa bandang dulo yung part kung saan yung NANDA showing you yung specific disease, as showing you the different diseases, and then under each disease, meron siyang nakaspecify na mga different nursing diagnosis na pwede nating magamit. So in this case, ito yung chronic obstructive lung disease, tapos ito yung mga pwedeng nursing diagnosis na nating magamit, okay, in crafting our NCP. So in this case, pwedeng ineffective airway clearance, impaired gas exchange, activity intolerance, imbalanced nutrition, risk for infection. Pero again, our priority here is the actual problem of the patient. Okay, so going back, so for example, among the different nursing diagnosis na pinakita sa atin ni Nanda, ang na-identify natin na pwede natin magamit sa pasyente, again, highly individualized tayo, ang gagamitin natin, and then based on the signs and symptoms ni pasyente, is definitely the ineffective airway clearance. So now, meron na tayong unang sagot sa ating nursing diagnosis. You have the ineffective airway clearance. Okay, so that's how we get our nursing diagnosis in the book, in the reference book that I told you earlier. So, ineffective airway clearance. So, pumunta ka na ngayon, for example, ang napili na nga natin is ineffective airway clearance. So, pumunta ka na ngayon to that specific part of the book kung saan dinidiscuss ni Nanda yung ineffective airway clearance. So, eto siya ngayon. Okay? It is nasa like parang kalagitnaan, or basta you go to that part kung saan dinidiscuss ni Nanda yung ineffective airway clearance. So makikita mo sa pinaka-heading niya, diagnosis is ineffective airway clearance. And then, ayun na, yung discussion of the different aspects or different parts or information about ineffective airway clearance. Okay, so that is for the first part of the formula, di ba? We now have a nursing diagnosis. Now, paano naman yung related to the other part of creating or stating our nursing diagnosis? So further related to, so again, we write down the simplified pathophysiology of COPD. So sinusulat natin yung related to by writing down the simplified pathophysiology of COPD. So basically, pag sinabi natin COPD, it is about the inflammation of the airway. So hindi pwedeng ilagay mo na related to COPD kasi that is a medical diagnosis, 'di ba? So again, our priority is kung ano yung part natin as a nurse, and we write this related to by yun na nga, simplifying the pathophysiology of the disease. And in this case, COPD. So, pag sinabing COPD, it is the inflammation of the airway. Tapos, kapag nasabi na natin, pag okay na tayo, so related to inflammation of the airway. So, yun yung related to natin, the etiology. Kung bakit, ibig sabihin, kung bakit nagkaroon ng ineffective airway clearance si pasyente, that is related to the inflammation of the airway. Kasi inflamed yung kanyang airway. Okay? And then, kapag okay na tayo doon sa related to, pwede natin ngayong sundan siya ng secondary to yung medical diagnosis ni doctor na COPD. Okay, pwede natin gawin yon. Pwedeng indugtong. Pero technically, remember this, technically, there is no need to write the secondary to. Okay, in some nursing schools, hindi naman na nila pinapalagay yung secondary to COPD. Pero if ever lang, at least you know na pwedeng lagyan ng secondary to and then yung medical diagnosis that we have for the patient. So our answer here, for example, yung nursing diagnosis natin kanina, ineffective airway clearance related to inflammation of the airway secondary to COPD. So we now have two parts of the nursing diagnosis. Okay, and then for the last part, so ito pa rin yung data na meron tayo, ano? For the last part, as evidenced by AAB, ito yung again yung mga signs and symptoms. Okay, the subjective and objective cues that we have gathered from our patient. So in this case, dito tayo magre-refer kung ano yung meron si pasyente. So ilalagay natin as evidenced by, so ito yung mga signs and symptoms na nararamdaman ni pasyente and na nakuha natin objectively. As evidenced by a patient having wheezing on bilateral, upper lobes during expiration, oxygen saturation of 90%, and patient having respiration of 26 breaths per minute or cycles per minute. And that's it. That's how we write the three-part statement of the nursing diagnosis. So let's just summarize the whole or let's just have the whole statement for that nursing diagnosis. So again, we have three parts: the nursing diagnosis, yung related to natin, and yung as evidence by. Nursing diagnosis, we get this from the NANDA. Related to, ito yung ating simplified pathophysiology of the disease process. Ito yung reason kung bakit nagkaroon na tayo ng nursing diagnosis. And then as evidenced by, ito yung signs and symptoms na meron si pasyente. So our answer for this, ang nursing diagnosis natin sa pasyenteng nagpapakita ng ganitong data is ineffective airway clearance. That is a nursing diagnosis related to inflammation of the airway secondary to COPD, as evidenced by patient having wheezing on bilateral upper lobes during expiration, oxygen saturation of 90%, and patient having respiration of 26 breaths per minute. And that is our first nursing diagnosis. Okay, so let's have another example ng nursing diagnosis. So our data here, S/P, that would mean a status post. Okay, ibig sabihin, kakatapos pa lang ng surgery ni pasyente, and that is laparoscopic cholecystectomy. Okay? So, status post laparoscopic cholecystectomy, this is our data. And since kakatapos lang ng surgery niya, which is cholecystectomy, the patient is complaining of 8/10 pain, acute pain to the right upper quadrant of the abdomen. So that is painful. 0, no pain. For the pain scale, 0, no pain. And then 10, the worst pain. So ibig sabihin malapit yung 8 sa 10. So that is really painful on the part of the patient. So this is now our data. So our task is to create a nursing diagnosis. Again, we have the formula here. Nursing diagnosis related to blank as evidenced by signs and symptoms niya. So ito lagi yung susundan nating format. So if that is the case, so definitely pain yung ating nakitang problem with our patient. So our answer for this is acute pain. So acute pain. So we have here acute pain related to. Bakit siya merong pain? That is related to the status post-surgical removal of the gallbladder. Okay? Kaya may acute pain si pasyente. That is because status post-surgical removal of the gallbladder. Ano yung signs and symptoms natin? Patient complaining of 8/10 acute pain to the right upper quadrant of the abdomen. So that is our nursing diagnosis for this patient, for this data. Acute pain related to status post-surgical removal of the gallbladder as evidenced by patient complaining of 8/10 pain to the right upper quadrant of the abdomen. So again, yung secondary to, wala, um, pwedeng wala na yon, okay? It's up to you. So pwedeng hanggang related to na lang tayo tapos status post surgical removal of the gallbladder tapos as evidenced by. Okay, so this is our second example of the nursing diagnosis. Now, pwede rin tayong magkaroon ng risk for na nursing diagnosis. So, ibig sabihin, potential problem. The patient may be at risk for developing that problem. Hindi pa nangyayari at risk pa lang yung pasyente. Okay? So, that could be a nursing diagnosis. Ibig sabihin, parang futuristic tayo, parang nakikita natin na pwedeng ma-develop ito sa ating pasyente. Pero remember, you have to address first the actual problem. Kung ano muna yung if the patient has an actual problem, nangyayari na, yun muna dapat yung isolve natin. Yun dapat yung priority natin. Okay, so for our third example, the patient has history of hypertension. Ibig sabihin, mataas yung kanyang blood pressure and patient having multiple blood pressure medications. So the meds are Norvasc 5 milligrams daily, atenolol 25 milligrams BID, clonidine 0.1 milligram, and then per orem of every 6 hours. Clonidine is 0.01 milligrams per orem every 6 hours PRN, okay, as needed. Pag PRN as needed for systolic blood pressure of greater than 160, okay, or yung kanyang diastolic blood pressure of greater than 90. And yung kanyang current vital signs are 130/70 and the pulse rate is 88. Okay, so if this is the case, okay, so we are tasked to have the nursing diagnosis kung risk 4 pa lang siya, potential problem pa lang. We do not have the evidence base kasi nga mangyayari pa lang siya. Again, if it's a risk 4 diagnosis, nursing diagnosis, wala tayong as evidence by na part. So we only have nursing diagnosis and related to. And since the main side effect of hypertension medication is orthostatic hypotension kasi ang dami niyang um, medication right for blood pressure. So ang pwedeng mong makita rito is that pwede siyang magkaroon ng orthostatic hypotension. Okay? So if that is the case, baka kasi biglang tumayo si pasyente, mahilo siya. So that is orthostatic hypotension. Or yung biglang yung pagkahilo at because of the low blood pressure or hindi pa biglang tayo ka tapos hindi pa tama yung circulation mo sa iyong head or sa iyong ulo or sa ating katawan, tendency baka tayo ay ma-dizzy or ma-fall. So, probably, yun yung pwede nyong maisip kapag maraming blood pressure medication si patient. Okay? So, if that is the case, so, ano pa lang siya, risk 4 siya. So, if that is the case, if that is the possibility, ang nursing diagnosis natin in here is risk for fall. Kasi pwede siyang mahulog dahil nga baka bigla siyang tumayo or na sobrang dami niya ng blood pressure, I mean, sobrang dami ng kanyang medications for BP, baka bumagsak naman yung kanyang blood pressure and then it might place her or him at risk for fall. So, ayun, so the nursing diagnosis is risk for fall related to the side effects of multiple blood pressure medications. So this is an example of a risk for nursing diagnosis. Okay, so in our example, so nursing diagnosis, so ito yung assessment natin kanina, no? So ito yung may lagnat si pasyente, okay? And then ayun yung kanyang temperature is 38.8. And then WBC is 18, which is high WBC count in the blood. So, tapos mainit yung kanyang pakiramdam. So, the nursing diagnosis in that example is hyperthermia related to increased metabolic rate or illness. Okay? So sometimes pagka ni-require kayo ng inyong school to provide the rationale for your nursing diagnosis, ayun, ilalagay niyo lang yung rationale niyo or yung reasoning niyo having or for having this nursing diagnosis such as hyperthermia. And again, your reference is your NANDA book. Pero usually, in our case, hyperthermia lang, I mean, the nursing diagnosis lang yung nilalagay, even without the rationale na. Okay, so that is for the nursing diagnosis. Next, we have the third component of the NCP is the planning or formulating a goal. So the nurse refers to the client's assessment data and diagnostic statements for direction in formulating client goals and designing the nursing interventions required to prevent, reduce, or eliminate the client's health problem. So your technique here sa pagsusulat natin ng planning or formulating a goal, so ibig sabihin nagpaplano tayo kung ano or yung nagkakaroon tayo ng goal or goals here or objectives kung paano masosolve yung ating nursing diagnosis na meron tayo. So, yun yung nilalagay natin sa planning or the goal. So, ang technique here is to reverse the nursing diagnosis. So, nire-reverse, binabaligtad lang natin yung nursing diagnosis. So, and then we have this criteria in writing our planning or our goal. So, ito yung tinatawag na SMART, S-M-A-R-T, SMART. So, in writing your planning or goal component of the NCP, it has to be SMART, meaning specific siya. You are specific, hindi vague, hindi paligoy-ligoy yung sinasabi mo. Measurable yung iyong mga sinusulat sa iyong plano, sa iyong goal, na may measure siya, nasusukat objectively, attainable. Ibig sabihin, pwede siyang ma-achieve. Okay, realistic. Okay, makatotohanan yung plano mo, and then time-bound, you have a time frame in achieving your plan. Okay, so let's have an example. Okay, so for example, ang gagamitin natin the nursing diagnosis na ineffective airway clearance related to inflammation of the airway secondary to COPD as evidenced by patient having wheezing on bilateral lobes during expiration and then oxygen saturation of 90% and RR of 26 breaths per minute. So ito yung kaninang example natin, yung pasyenteng may COPD. So paano tayo mag-formulate ng goal or plano? So again, in crafting our plan for the patient, it has to be SMART. So in this case, ito yung ating plan or goal for this patient na may COPD na merong ineffective airway clearance. Again, yung plano natin, yung gusto nating ma-solve is ineffective airway clearance. Gusto nating ma-solve yung nursing diagnosis natin. So to do that, ang ating plano is after 6 hours, the patient will have an effective airway clearance as evidenced by patient having clear lung sounds on bilateral upper lobes during expiration, patient having O2 saturation of 94%, and patient having respiratory rate of 16 to 20 breaths per minute. So if you could notice, reverse lang natin itong ating nursing diagnosis. Yung mga abnormal, ginawa lang natin siyang somewhat normal. Medyo in-range natin siya to a normal range. Okay? So, kagaya nito, ineffective airway clearance, gusto natin maging effective yung kanyang airway clearance. Papaano? As evidenced by, kung siya ay may wheezing on bilateral lobes, ang gusto natin, maging clear yung kanyang lung sounds on bilateral upper lobes. And then, yung kanyang oxygen saturation from 90%, ang gusto natin, tumaas siya, maging normal siya, at least maging 94% man lang. Okay, and then yung the RR, from 26, gusto natin maging normal from 16 to 20 breaths per minute. So, again, tignan nyo if pasok siya sa criteria na SMART. Specific siya, Okay? This plan is specific kasi kita natin kung ano yung mga gusto nating i-measure. Ano yung mga parameters na gusto nating mangyari. Okay? And then measurable. So ayan, kitang-kita natin na it can be measured, like yung it is quantifiable. Okay, pag measurable, it is quantifiable. Like for example, O2 sat from 90 gusto natin maging 94. RR from 26 gusto natin maging 16 to 20. So that is measurable. Next, attainable. So after 6 hours, definitely pwede nating ma-attain siya. Itong goals na to, itong plano na to. And realistic siya within 6 hours. And then time bound ba siya? Definitely. Kasi after 6 hours nakalagay. So as a nurse, it depends sa inyo kung gaano nyo katagal gustong magplano or matapos or magawa yung inyong NCP. So pwede diyang 1 hour depending on your nursing diagnosis. Pwede yang 1 hour if it is immediate or gusto mo yung mabilisan na talagang you are sure realistic naman siya, pwede yang 30 minutes or 1 hour or kaya after 2 hours, after 4 hours, after 8 hours, or after the shift, which is after 12 hours. You have to be specific. Okay? Hindi pwedeng after the shift. Kasi hindi naman namin alam, baka 8-hour shift kayo or 12-hour shift. So you have to be specific of the time. Okay? So, yun, that is one way on how we craft our planning. So, another example natin. So, another, yung ating nursing diagnosis kanina, yung acute pain related to status post surgical removal of the gallbladder, yung cholecystectomy natin, as evidenced by patient complaining of acute pain to the right upper quadrant of the abdomen. So, yung pwedeng plano natin sa kanya, since may pain siya, acute pain, so the patient is experiencing pain. So, yung plano natin dito is after 3 hours, pwedeng ilagay dito after 3 hours of nursing intervention. So, the patient will have a tolerable pain as evidenced by patient having a pain scale of 2/10 or lower to the right upper quadrant of the abdomen. So, from 8 to kanina, di ba? From 8/10, gusto natin maging 2/10 na lang yung kanyang pain scale. So, specific siya, measurable because of the pain scale, and then attainable, realistic, time-bound because after 3 hours. Okay, so in our case kanina, sa may lagnat, okay? So you have now assessment, we have the hyperthermia as our nursing diagnosis. Our goals, by the way, yung goals natin, pwede pala siyang, again, goals it can also labeled as planning, ano? So pwede siyang short-term goal and a long-term goal. So short-term goal natin, ibig sabihin, mabilis ang goal. Okay, this can be accomplished from minutes to hours yung ating short-term goal. Depending on your institution. Okay, kung ano yung kinoconsider nilang long-term na kung ano yung short-term. So, for short-term, commonly, hours lang yan. So, for in this case, after 2 hours of nursing intervention, the patient's temperature will go down from, ito siya, 38.8 degrees Celsius to 38 degrees Celsius. Kasi 2 hours naman, ano? And then will not develop associated complications like seizure or brain damage. Yung long term, pwedeng long term dito. Again, for long term, pwede siyang mag-take ng 2 days, 3 days, or more. Pwedeng 7 days or 10 days, depending on the condition of the patient then, and depending on how you view yung pagka-long term, okay, ng iyong plano. So in this case, after 2 days of nursing intervention, the patient will demonstrate behaviors to monitor and promote normothermia such as proper fluid intake. In our format, commonly, short-term lang yung ating pinapalagay. Okay, so that is for the goals or planning. Now, a variation of this format. So, AdoPie, 'di ba, we have yung pinapakita ko sa inyo is the AdPie. In other institutions, they are using AdoPie. So, assessment, nursing diagnosis. And then yung O is outcome identification. So, for this, how do we fill this out, yung outcome identification? So, titingin lang tayo sa ating NCP na naman or si Nanda pala. We're just going to look at our Nanda and meron tayo nung makikitang desired outcomes or evaluation criteria. So, pipili ka lang doon kung ano yung gusto mong maging outcome sa pasyente mo. Okay, so pili ka lang dyan and then you place that dito sa iyong outcome identification. So, kung meron kayong outcome identification in your format, so dapat banggayan with your planning. Okay, so in our case, add pie lang tayo. We do not have naman si outcome identification. So, we are going to focus na lang with add pie. So, diniscuss ko lang, pinakita ko lang yung add pie. Okay. And then the fourth component of NCP is the interventions. Okay, nursing interventions. Ito yung mga gagawin na natin sa ating pasyente. So we assist the client to meet the desired goals or outcomes. Ito yung mga gagawin natin para makuha or matupad natin yung plano or yung goal na gusto natin. So, interventions, this refer to the nursing interventions na related to o kaya applicable to your nursing diagnosis. So, definitely, ang pagbabanggaan natin dito are our nursing diagnosis and yung planning. Okay? We consider also, in our planning, by the way, we consider yung condition of the patient and yung mga interventions na pwede nating magawa. Kaya nga, di ba, when we plan, we have to be sure na smart siya. Specific, measurable, attainable, realistic, and time-bound. So, yung interventions, again, these are listed in your NANDA or your care plan book. You may refer to that for your references. I mean, for your reference or for information. So start your intervention, it start with assessments. So nag-assess ka pa lang, nag-iisip ka na ng intervention or probably may ginagawa ka na sa pasyente mo. Okay? So again, the intervention, it starts usually in our assessment. Interventions then um, yung mga ginagawa natin or kina-craft nating interventions, these are the things that help to treat the nursing diagnosis. So ito yung mga gagawin natin para ma-correct yung nursing problem or nursing diagnosis natin. Okay, so now for your interventions, you have independent nursing intervention, you have dependent nursing intervention, and then you have collaborative. So yan yung pagkakaayos or sometimes yan yung format na ginagamit in accomplishing the nursing interventions. For example, ang gagamitin natin na nursing diagnosis para makakraft tayo ng nursing intervention is yung ineffective airway clearance natin, yung may COPD. Okay, related to inflammation of the airways. Okay, secondary to COPD as evidenced by patient having wheezing on bilateral lobes during expiration, oxygen saturation of 90% and RR of 26 breaths per minute. So this is our nursing diagnosis. So how do we now craft a nursing intervention out of this nursing diagnosis? So for that matter, we have here the column or the part interventions, tapos the rationale. Meaning ng by the way, depends on your institution. Sometimes wala ng rational, pero most of the time, pinapalagay yung rational para alam ng estudyante yung reason kung bakit niya gagawin yung intervention na yon. Ibig sabihin, evidence-based tayo. Okay? So, first we have here the independent. So, ang pwede natin gawin sa pasyenteng may ineffective airway clearance, number one, assess patient vital signs every 4 hours. Again, when we say pala independent, ito yung mga nursing interventions or nursing actions na pwede natin gawin as a nurse. Okay, yung within the scope of our nursing practice. Ito yung mga pwede natin gawin to our patient to alleviate the problem or to solve the nursing diagnosis that we have. So ito yung within our range independently. So assess patient vital signs every 4 hours. Rationale or the reason because assessing patients' vital signs help monitor patients' respiratory status. Number two, monitor patients' respirations and breath sounds every 4 hours. What's the rationale? Because monitoring respirations and breath sounds, it is indicative of respiratory distress and or accumulation of fluid. So doon natin malalaman kapag nagkakaroon si pasyente ng respiratory distress or accumulation of fluid. Now, commonly, yung mga independent, yan yung mga monitoring natin sa ating pasyente, assisting our patient, okay? Tepid sponge bath, um, assisting the client, health teaching. So, ayan yung mga independent commonly. Now, for the dependent, ito naman yung mga interventions na pwede nating magawa as ordered by the physician. So, ito yung mga kailangan ng order na nanggaling kay doc. Okay, yung mga interventions na gagawin natin na dapat na order sa atin ng doktor. For example, kung nahihirapang huminga or ineffective airway clearance yung ating diagnosis, we may administer patients breathing treatment and then kung ano yung medication na gustong ipabigay ni doktor every 4 hours as needed per physician's order. So again, yung dependent, nakadepende tayo sa order ni doctor. And then the rational breathing treatment is a bronchodilator that opens up the airway. Okay, so in our example naman sa kanina nating may lagnat, hyperthermia is our nursing diagnosis. Ito na yung ating tabulated or yung formatted nating NCP. So we have here the part of interventions and another column for the rational. So you have again the independent and you have the dependent. So ibabangga mo lang yung independent mo with your rational. Kung bakit siya dapat gawin, ito yung reason. Okay? So independent for the hyperthermia, so number one na pwede natin gawin, yung monitor again. Okay? Kadalasan, di ba, we monitor talaga. Temperature and pattern every 1 hour and no chills or profuse diaphoresis. Why? Ano yung rationale? Because temperature of 38.8 suggests acute infectious process. Next, provide cool environments and or fans. Heat loss. Why? Bakit natin gagawin to? Because pwede siyang facilitate ng heat loss by convection. 3. Provide surface cooling by means of undressing. So heat loss naman to occurs by radiation and conduction. And then number 4 na ating independent nursing intervention, provide tepid sponge bath or localized packs to groin and axilla for 15 minutes. Why? Bakit mo siya gagawin? What's the rationale? Because it may help reduce fever by evaporation and conduction. Number 5, promote client safety by putting side rails up. Why? To avoid incidents of fall. So these are all the independent nursing interventions and these are the rationale for that. Again, pwede nyo maging reference dito si Nanda. Meron siyang suggested na nursing interventions for you to do. Tsaka yung mga rationale for that interventions, makikita nyo rin doon. And then number 5, yung mga the other part of the interventions, you have the dependent. Meaning, nakadepende tayo sa doctor's order. For example, under dependent, we have here administer fluids and electrolytes. Kung naka-IV naman siya, tuloy-tuloy lang naman yon. So, to support circulating volume and tissue perfusion. And then administer medications as ordered and indicated, such as antipyretic. Why? To reduce fever by its central action on the hypothalamus. So, disregard this na lang. Okay, so these are our interventions and the rationale for our hyperthermia na nursing diagnosis. So, that is ayun, pinakita ko pala dito, this is an example of an excerpt from the Nanda book okay, from the NCP book or the Nurse's Pocket Guide kung saan pwede kayong kumuha ng intervention. So ito, pwede siyang identify the underlying cause. Why? So ito yung kanyang rationale. Naka-bold most of the time yung rationale. So, ano pa? Ito yung monitor core temperature by appropriate route. So pwede siyang intervention. Why? So ito yung kanyang reason. Monitor blood pressure, monitor heart rate and rhythm, monitor respiration. So again, you may choose the nursing interventions na meron tayo sa NANDA depending on your patient. Again, it has to be highly individualized yung ating nursing interventions na gagawin. And then the last part of the NCP is the evaluation. This is the last, the last component of the NCP. So for the evaluation, this is to evaluate. To evaluate is to judge or to appraise. And assessing, and in evaluation, we are assessing whether the goal is reached or not. So paano natin kinakraft or dinedesign yung ating evaluation? We either place here goal met, goal partially met, and goal not met at all. Okay? Or goal not met lang. Okay? So, how? So, let's have an example. So, yung ating so pag sinabing goal met, this is when all of our goals have been met. So, goal met, lahat ng goals, lahat ng naplano natin doon sa ating planning components ay na-achieve natin lahat. Okay, let's have an example. Sa halimbawa, yung planning or goal natin, we will use yung kanina, yung after 6 hours, the patient will have an effective airway clearance as evidenced by patient having clear lung sounds on bilateral upper lobes during expiration, patient having oxygen saturation of 94%, and patient having RR of 16 to 20 breaths per minute. So ito yung may COPD, yung may ineffective airway clearance kanina. So if this is our plan, this is our goal. So again, kapag goal met siya, if all of the goals or plans that we have indicated here are met. So the answer here, this is how we craft our evaluation for the goal met. So ilalagay nyo goal met as evidenced by, ito lang siya, i-rewrite nyo lang siya. Patient has clear lung sounds on bilateral upper lobes during expiration. Patient's O2 saturation, kasi nangyari na to, So, patient's oxygen saturation is 96% and patient having the respiratory rate of 18 breaths per minute after 4 hours. Ibig sabihin, lahat ng sinulat natin dito sa planning sa ating goals kanina, na-achieve natin. All goals are met. Okay, so remember na ito dapat yung makita talaga natin to our patient. Ito yung mga evidences na magpapakita na we really achieve our plan, our goal. So, goal met. So, this is the first for the evaluation. Ngayon, paano naman kung goal partially met lang? Ibig sabihin, hindi lahat ng nailagay natin sa planning ay na-achieve natin. So, goal partially met, this is when not all of your goals have been met. So, yung pa rin yung example natin kanina, So, paanong mangyayaring goal partially met lang? Halimbawa, so we graph this evaluation part na ganito. So, goal partially met as evidenced by kung hindi natin na meet yung yung gusto natin na clear lung sounds kasi 'di ba ang gusto natin after 6 hours clear yung lung sounds niya. If for example nung nag-evaluate tayo after the nursing interventions, nag-evaluate tayo tapos narinig natin na may wheezes pa rin siya or wheezing pa rin yung kanyang bilateral upper lobes during expiration. So, ibig sabihin, hindi natin na-met yung part na yon. Okay? Pero otherwise, yung iba naman, patient's oxygen saturation is 96%, although ang set lang natin is 94. Pero 96% that is better. Kaya met talaga. Met na met itong oxygen saturation. And the patient having an RR of 18 breaths per minute after 4 hours. Kung mas maganda yung improvement, then that is much better. Okay? So, ang hindi natin na-meet dito or hindi na-achieve na goal dito is yung wheezes. Meron pa rin, the patients still have wheezes on bilateral upper lobes during expiration. Kaya, goal partially met lang. Meron tayong hindi na-achieve na isang goal or isang parameter sa mga sinet natin. Remember, ginagawa lang natin yung evaluation natin kapag nagawa na natin yung nursing interventions, tapos na dumating na yung time na sinet natin sa ating planning. Yung after 6 hours, kung yun yung set natin, o kaya after 4 hours, so dun tayo nag-evaluate. And then the other one is goal not met. Ito yung ayon sana nating mangyari pero nangyayari siya because again, highly individualized or it depends pa rin sa ating client and among different factors. So goal not met, this is when none of our goals have been met. Kung wala sa mga pinlano natin or sa mga goals natin yung na-achieve natin in our nursing intervention. So, again, having the same plan or goal sa kanina about ineffective airway clearance. So, lahat ng ito, lahat ng pinlano natin, lahat ng goals natin, hindi siya na-achieve. So, how do we write that? Goal not met, as evidenced by patients still having wheezes on bilateral upper lobes during expiration, tapos yung patient's oxygen saturation is 92%. Okay, and patient respiration is 28 breaths per minute after 4 hours. So do not forget after yung time na sinet mo, kailangan ma-restate mo. So yun yung how we write the evaluation part. It's either goal met, goal partially met, or goal not met. So in our case, in our example kanina, yung may hyperthermia, short-term goal. By the way, for the evaluation, kung meron tayong short-term and long-term, pwede rin nating evaluate siya by short-term o kaya long-term, depending kung naglagay tayo ng long-term. So, in this case, goal met. Okay, kung may short-term tayo. Kung short-term siya, goal met as evidenced by decrease in temperature from 38.8 degrees Celsius to 37.9 degrees Celsius and absence of chills after 2 hours. Again, do not forget yung time. After 2 hours. Okay? Please write na lang dito. After 2 hours. Okay, and that completes our nursing care plan. So, ito yung usual na format that we have. Add pi tayo. These are all the components na discuss na natin lahat, the assessment, nursing diagnosis, goals, interventions, rationale, and evaluation. Although you may see a variation or a format like this, so you have to follow the format given to you by your nursing school. Pero in our case, just coordinate with your clinical instructor para malaman ninyo yung format na gagamitin. Pero again, add pa yung ating common na ginagamit. So I hope na you have learned something from this discussion on how to create an NCP. Thank you and God bless.